Very good morning. I'm Dr. Aditya Paliwal, Chief Medical Officer at Patalganga Manufacturing Division. It's one of the RIL plant. My topic of presentation is a study to recognize the digital healthcare initiatives and the best practices at the workplace at the PMD site. Just one slide for our PMD division, which is located at the Raigad, Maharashtra district. It is the integrated plant of the petrochemical and the polyester, which was first established in 1982. This is a mother plant. So at the medical department, we have Occupational Health Center, Dhirubhai Ambani Hospital, Township Medical Center, as well as the ART Center. So we are dealing with basically at all the levels of health perspective, whether it is promotive, preventive, community healthcare, and other aspects. This is the index which I'm going to quickly go through over the introduction part, aims and objectives, methodology, digital tools for the COVID safety, and there are other digital tools which we have incorporated in the last 2 years, at results and discussion, and finally the forward path. We all know this digital part and various healthcare initiatives in the terms of digital. We all know the entire medical fraternity is a part and parcel and supports the medical department in a very broad perspective. We at Reliance has analyzed some of the aspects in the last 2 years. We had analyzed also, we have defined the scope, existing scope, that how we can further help our medical part in terms of the digital support system. In addition to the few digital innovations in the field of occupational health, industrial hygiene, emergency management, these are also perspectives which we have taken into our study. The aims of the digital, my study is to have the system which is efficient, accessible, inclusive, affordable, timely, and safe. The objectives are basically to enhance the competency among the medical team at all levels, to enhance the quality deliverables for all stakeholders, and to have the robust data analytics for the target group action plan. So this is the main 3 objectives which were taken considering the existing scope and further to enhance the scope to help the medical department in terms as a whole. We analyzed the data of the last 2 years, 2022, and to interpret it, how the transformation and the upgradation of the digital health tools helped us to focus on the various aspects of the functions of the medical department. The main aspect in the study is to review the access and usability. Every employee has their individual ID, and that is integrated with their ESS part, along with other aspects of the digital tools which they are in their company. They are basically functioning. Data management, privacy has been taken care. Employee communication, as well as the report generation, and finally the health and safety portal, an integrated approach. I'm going to share only few aspects which were mainly as a part of our support system during the pandemic times. And these are the various components which we have taken. I can say that some of the components which are very useful in those particular time, and with the help of the IT team and mainly brainstorming from the medical side, from the central team as well as at the site also, we are able to have few aspects. One is the monitoring the symptoms by the symptom checker in the ESS system, individual QR code, green pass entry system, investigations upload in our existing HMS system, and the tracking system, also the vaccination tracking by our in-house digital app. This monitoring of the symptoms during the pandemic times, all the employees has to basically the entry into their ESS part about the symptoms. So when they enter the system, it goes to the HR, and the number of the people, those who are coming to the plant, they are being shared to us, and our medical team is going to coordinate with that, how many people are suffering, and so that action plan and the timely treatment is provided to the whole people, those who are having the symptoms. So this is one, monitoring the symptoms through the digital part. Second is the green pass entry. Once during the entry into the plant, after the thermal screening, on-site RT-PCR scheduled for a week for both the contract workers as well as the employees. So once this every weekly schedule if the employee is undergoing and he don't undergo the test, his card was blocked. So there are 2 system checks. One is the symptom checker, and second is this green pass. So you can see this, both the green pass and the symptom checker are double check system for the plant to prevent the transmission at the site. In the initial period of time when the pandemic has started, we have the TRFs, which is the test required form. And we discussed with the team that how this can prevent this wastage of the paper. So in 2021, then initially we have 600 to 700 papers being used daily for the RT-PCR testing. But later on, the QR code is impinged on the individual ID card, And with that, the scanner, finally, we can say the touch point also has reduced, as well as the paper saving was the main part. Then we have developed one tool in our HMS system, that is a COVID ticket status. Basically, this tool is to help the people, those who are positive, as well as those who are on the quarantine, and for the post-COVID follow. Now, these few aspects of this tool is to monitor at 3 levels. One is that primarily when they are diagnosed, then the follow for the 7 days period of time, and after that, then there will be a follow for post-COVID part. We have divided few people, the patients, or we can say the employees, those who are high-risk groups. 26 employees are still on the follow-up through this COVID ticket status. And this is a very important tool which has helped us, because this is the one which we can say that during COVID time as well as post-COVID, and now this is a phase which is going where we can follow up them upon those specifically related to their comorbid conditions. This is the in-house Kiwi Health we have created, because across the site as well as at our site, we have vaccinated more than 7,000 people, which covers employees, family members, as well as the contract staff, including the people, those who are from the community. This is the app, integrated app, which we have created, which is basically for the administration, record, stock maintenance, and the cold maintenance of all the people, those who are being vaccinated in the premises, those who are staying in the township, and vaccination. And this system is integrated to other sites so that we can actually see the stock, how many people are vaccinated, and accordingly the different dates and schedule is being monitored.
Please conclude.
Finally, this is enhanced various virtual communication. With this mode, we can connect to more people. And in the wellness front, we have created many tools, and there are many views by the employees as well as family members and different pages, which is reflecting in their ESS as well as their individual ESS. We have an upgraded system which is now integrated with GeoHealth Hub. That is the biggest advantages. We have the existing HMS system which is also integrated with that. So once the reports get generated into the system, it can connect it to the system, and in the GeoHealth Hub, which is again any employee can see. So this is a result which I already discussed. It has shown a great support system to control the pandemic at site, as well as the one-point solution as a digital platform to enhance the existing scope, and further also how we can help in future. The conclusion of my study is improving the health of the population, improving the patient experience, reducing cost, and improving the healthcare provider experience at all stakeholders. So forward path, definitely we're looking forward based on this WHO healthcare initiative, this model that addressing a health need, which should be sustainable, accountable for long-term cost, and we are working on the chemical dashboard, which is going to be there across sites at one platform. We are going to utilize the 5G technology as well as the data focus for the target group. I acknowledge my site management, Dr. Nikunj and Dr. Rajesh, for their support. Thank you.
Thank you. Thank you, Dr. Aditya. If we have any question, so the floor is open.
Very good initiative of other sites also, and other than your company. Have you shared these tools with other organizations?
Yes, sir. To other organizations, few aspects with respect to the COVID follow-up part, as well as the symptom checker. Few organization has discussed during our IH meeting also, we discussed with that part. Thank you, sir.
Thank you.